Good evening. I'm Rosie Duffield, your Labour Party candidate in the general election and standing to be your MP. The Labour Party created the NHS in 1948, at a time when austerity was even worse than the current austerity started by the Tory and Lib Dem coalition since 2010. There's a lot of deliberate false information that the NHS is inefficient and unaffordable, but the opposite is in fact the case. In fact, international comparisons show our NHS to be one of the most cost-effective and in the world, one that is accessible to all and delivers high-quality healthcare. We achieve this despite the UK spending less of our GDP on healthcare than any other EU country. The Labour Party recognises the enormous contribution made by EU citizens, almost 60,000 people, without whom the NHS would struggle to cope. Last year, a staggering 17,000 EU citizens left the NHS. Labour will immediately guarantee the rights of EU staff working across our health and care services. I know, like me, most people here are extremely concerned about the K&C hospital. On Saturday, I will be joining the march organised by the FAB team at Czech. But my concern is also for the whole of the NHS, because what's happening to the K&C is just part of wider changes which are being carried out behind closed doors. Theresa May has repeatedly stated that she supports the Naylor report, a shocking plan to sell off hospital buildings and strip NHS assets. The government's sustainability and transformation plans are the biggest reorganisation of the NHS since the last one. I'm particularly concerned because the plans are being driven not by the desire for service improvement, but by sheer lack of money. What is happening to our NHS is chronic underfunding, not overspending. Labour believes the model of care these plans are proposing will make it far easier to privatise our NHS. So instead, a Labour government will immediately review the STP process, halting all threatened hospital closures, and invest £37 billion of extra funding over the course of the next Parliament. We will achieve this by raising income tax on private medical insurance and on the highest 5% of earners. And we will halve the fees paid to management consultants. We will reverse the privatisation of our NHS and return our health service into expert public control. We will also give mental health the same priority as physical health, set up a new £250 million children's health fund, and prioritise the rights of disabled people. The Labour Party manifesto on the NHS clearly shows that we remain the party of the National Health Service. Thank you.